And we do have this patchwork of guidelines around the country. Some states have opened up a little bit, some not as much. Can we even begin to get Americans to get on board if we have essentially regions of the country that are operating in very different ways? I mean, how do we
Yeah.
actually get a unified a response to this if we're not, we have states that are acting all very differently?
Well, that is a simple question, Deborah, but the answer is complicated because of the great divergence of opinions throughout the country and the independence, as it were, of the states and local areas of the kinds of decisions that they want to make. I have said over and over again, and that's the reason why I welcome a dialogue with you, Deborah, to get the message across that there are 5 or 6 things that if everyone at a minimum did that, we know from history of other countries, we know from what we've seen in our own country, that if you do that, you can turn around the surges and prevent further surges. And they're the things we keep talking about. I mean, there's not that difficult of the universal wearing of masks, the social distancing, the avoiding crowds, the outdoors, favoring things that you do outdoors versus indoors, washing hands, etc. The issue is that because of the divisiveness that we've seen in this country, we having, I think, maybe understandable because of the differences, but unfortunate divergence where people say either lock down completely or let it rip, have crowds, go to bars. That shouldn't be that way. There is a golden mean in there based on the guidelines that we carefully put together about how you can open the country safely. Some people think that public health measures are kind of the obstacle to opening
Mm.
up. They're not. They're a gateway and a vehicle to safely opening up. Because if you follow the guidelines, the checkpoints, you start off by saying you've got to get past one checkpoint. If you do well, you carefully move to the other. That's a phase. You go to the next phase and the next phase. If you do that properly and carefully and prudently, you won't see these surges. But yet, understandably, and this is, I guess, the nature of this illness, the nature of this infection is quite unique.